medications for cough, cold, and flu. The presenters will be Charlene, Charity, Elba, Lena, and Kathy. Cough is a common symptom of upper respiratory diseases such as cold or the flu. Coughing is actually a protective reflex that helps the body clear the mucus out of the airway and prevent inhalation and aspiration of foreign materials. Therefore, suppressing coughs may be inappropriate in certain disease processes where expectorant is beneficial or therapeutic. Coughing can be categorized into productive or non-productive. Coughing can be further classified by the duration, either acute, subacute, or chronic, but whenever possible, treating the underlying cause of cough and not the cough itself is indicated. Both the flu and the common cold are both contagious respiratory illnesses, but they are caused by different viruses. The flu is caused by the influenza virus only, whereas the common cold can be caused by a number of different viruses. Because colds and flu share many symptoms, it can be difficult to tell the difference between them based on symptoms alone. But in general, the flu is worse than the common cold, and symptoms are typically more intense and begin more abruptly. Fevers, aches, chills, fatigue, cough, and headaches are common in the flu. Colds are usually milder, with having runny or stuffy nose and sneezing. Sore throats with mild to moderate coughing is also common in the cold. I do want to point out that fevers are more common in kids and rare in adults. So whether it is the cold or the flu, a lot of the over-the-counter medications that we will talk about target the relief of these symptoms. There are non-pharmacological methods to reduce your risk of catching the cold or flu. You can wash your hands frequently, avoid touching your face, and clean or disinfect frequently the surfaces of objects, and protect others when you are sick with the cold or the flu by staying at home and practicing good cough and sneezing etiquette. For non-drug treatment options, getting adequate rest and drinking plenty of fluids to stay hydrated is key for the recovery of cough, cold, and flu. Specifically for coughing, honey was found to be better in reducing the frequency of cough and severity of cough than diphenhydramine and provide more relief for cough. Also, drinking warm water and sucking on ice chips or popsicles can help soothe irritated throats. For nasal congestion, using cool mist humidifier or saline nose drops or sprays can help make breathing easier by decreasing congestion in the nasal passages. For our pediatric population, nasal suctioning with a bulb syringe can clear the mucus out of the nose and allow kids to breathe better.
OTC cough, cold, and flu products are available in a few drug classes, including antitussives, decongestants, antihistamines, analgesics, and expectorants. We identified approximately 79 products across different drugstores for cough, cold, and flu. Majority of the drugs included in a combination of drug classes to treat multiple symptoms associated with cough, cold, and flu.
So the first drug class that we're going to talk about are antitussives. These include dextromethorphan or dextromethorphan hydrobromide. These act by suppressing the medullary cough center to regulate a cough. With these drugs, we want to watch for the individual variation. They're definitely high risk for patients with chronic lung conditions such as COPD or asthma, and they're also not recommended in patients who are less than 2 years old. So in patients with chronic cough or chronic lung conditions such as asthma, you definitely want to make sure that we're advising these patients and making them aware that it does suppress your cough reflex and can reduce your breathing rate when taken more than the recommended amount. Medication safety issues, we want to make sure that patients are aware it does have a risk for serotonin syndrome as well as a high potential for abuse. So we want to have patients consult their pharmacist prior to purchasing these drugs and making sure that they discontinue the medication and seek professional help if the cold and cough symptoms stop improving or worsen over time. So the next one is decongestants. These are phenylephrine or oxymetazoline. These activate alpha and beta adrenergic receptors in the respiratory tract. They come in different forms, and they also have a high risk in children under 2 to 6 years old, and also in patients who have pre-existing cardiovascular conditions. These do have sympathomimetic properties, and also in patients with cardiovascular disease, can increase pulmonary arterial pressure and can precipitate underlying heart failure, angina in patients with severe atherosclerosis or past medical history of angina. We do want to advise patients on extended release products for children and making sure that they're not crushing these, as well as accidental ingestion of nasal sprays in children and making sure they have the contact for poison control, and also seek medical attention if accidental ingestion occurs. The next one is antihistamine and antitussives. These are dextromethorphan and chlorpheniramine, as well as dextromethorphan and doxylamine. The chlorpheniramine is an antihistamine with H1 receptor activity. The doxylamine competes with histamine on receptor sites of effector cells. With these medications, we definitely want to avoid use in older adults. They are part of the BIAS criteria due to their anticholinergic effects, and they do, like before, with patients with chronic lung conditions, we want to caution patients with COPD and asthma. Medication safety issues, these can definitely have an additive sedative effects when used with alcohol or other sedative drugs, and we definitely don't want to use these to sedate our children. So making sure that we have a comprehensive patient history that includes all the over-the-counter medications that they're taking is very important.
Next, we have the analgesics, non-opioids, antitussives, and decongestants. Some generic drug examples are acetaminophen along with dextromethorphan and phenylephrine, which we discussed in previous slides. The mechanism of acetaminophen is not fully known, but may be due to activation of descending serotonergic inhibitory pathways in the CNS. It is advised to use with caution in patients with cardiovascular disease, as they are CYP2D6 poor metabolizers. Because these drugs contain acetaminophen, it is important not to exceed the maximum recommended daily dose. It is also important to limit alcohol use. Glufenicin is an expectorant found primarily in Mucinex and Robitussin and works by decreasing surface tension and adhesiveness in the respiratory tract, which facilitates removal of viscous mucus. It is not given for prolonged periods if cough persists or accompanied by a fever. Oral packets may be swallowed whole or sprinkled on soft food. It is contraindicated in patients with any hypersensitivity to any component of the drug. There's also a fetal risk and infant risk with the drug, so breastfeeding is not advised and pregnant mothers should avoid use. Glufenicin use should not last over a week, as cough lasting over a week may indicate serious illness, and we also want to monitor for reduced cough and cough productivity in these drugs.
We're going to talk about cost of these medications. I went to CVS pharmacy that is close to me, and on the right-hand side is a QR code to scan to go to the website. Some of my peers went to Walgreens, and usually the prices are different, just plus or minus $1 or $2. So we have the Robitussin, which comes in a liquid form. On the left-hand side is the adult version, and the right-hand side is for children. Usually most of these cough or flu medications have directions at the back of the box. So it's important that we're educating our patients for them to read the direction of the maximum dose. And also a cup is provided where they can measure most of these liquid medications as well. So we have Mucinex. Mucinex comes in a tablet form, a liquid form, and we also have a children version of Mucinex. Also, Walgreens and CVS has their own brand. So you can see like the tablet, the adult is $18.49 and CVS is $12.49. So there's a $6 difference, which is important to educate patients with these differences so they can choose what is affordable for them. And then we have Dayquil and NyQuil. It comes in a liquid form and also liquid caps. Again, these the cost varies based on if they're tablet or liquid form. Sometimes you can see the Dayquil and NyQuil combined at a price which can be a little cheaper. And also on the slide is direction of the maximum dose and how to take it. And then we have Decilim cost, which comes mostly in the liquid form. You can see on the slide, ages 6 to 12 is 5 ml, and then adults and kids 12 plus is 10 ml. So there's a variation in the amount of doses for each age. And then we have Theraflu. Theraflu comes in a packet and liquid form. Usually the packets are dissolved in water or tea. So it's important that we're reading some of these directions to see how much water we need to dissolve this medication to get the maximum effect. Again, the prices are listed in the slide and the direction to take is listed as well. And similarly, we have the Alka-Seltzer cost, which comes in a tablet and also like a dissolvable tablet. So like this one says two tablets in 4 ounces of water every 6 hours. So it's important, again, we're reading these directions and we're educating our patients on the differences and how to take these medications. And then we have the Coricidin high blood pressure that comes mostly in the liquid form. And the dosing is also seen, and there's just $1 difference between the tablets and the liquid form that is shown on the slide. And lastly, we have the Sambucol, which comes as an elderberry, which is easy for to chew, but some people prefer using water as the tablet form, and also comes in the liquid form, which is a little bit more expensive. So again, it's important we're educating patients on the direction of use and also the maximum doses written on the medication.
Okay, so next I will speak about prescription options for cough, cold, and flu. We have benzonatate, and it's our first prescription option. Benzonatate is FDA approved for adults and children, and is the most common antitussive medication. Dosage form are included within this slide. Next, we have a very highly addictive and habit-forming prescription medication that are meant to be prescribed for a short period of time. These are promethazine with codeine, which are not safe for children under the age of 18, codeine with phenicin, which have opioid, and Bromfed, which comes in liquid form. The next series of medication is for influenza or the flu, and these are the prescription options. The first one is Tamiflu, and it comes in pill or liquid form, and is used to treat patients on the age of 14 days or older. The second one, we have Cephalexin, and is prescribed to patients who are age 5 or older as well. The third option for influenza is Velenessa, and this one is an inhaled powder and approved for those who are age 7 and older. And it is less commonly used because of how it is given, inhaled. And also, I'd like to point out that it's not recommended for people with respiratory problems like COPD, asthma, due to risk of bronchospasms. Adverse effect is swollen sinuses for Velenessa. For the next and last option for flu is Repibab, and is approved for those who are age 6 months and older. And it is less commonly used because it is given via the IV route. Adverse effect, insomnia, and diarrhea. So this concludes our slide, and this is our reference. Thank you so much.